You stand up from your favorite chair, push with both hands, and your legs still feel weak before you even take the first step. That can feel like age catching up with you, but sometimes it is your body waving a flag that vitamin D has fallen too low. National data from 2011 to 2014 found that about 73% of Americans had sufficient vitamin D levels, which means about 27% did not meet that mark. And the risk rises as we get older. Because aging skin makes less vitamin D from sunlight, many people spend more time indoors, and food intake often slips. Vitamin D is not just a bone vitamin. It helps your gut absorb calcium and phosphorus, keeps bones mineralized, supports muscle function, and plays a role in immune regulation. When it drops too low, the symptoms can spread across the whole body. The first sign is fatigue that does not match your day. Not ordinary tiredness after yard work or a busy weekend, but a heavy, low battery feeling that hangs around even after sleep. Fatigue is not specific to vitamin D deficiency, so it should never be blamed on one thing automatically. But when fatigue comes with aches, weakness, low mood, or more infections, vitamin D deserves a closer look. The second sign is muscle weakness, especially in the thighs, hips, and shoulders. This is the kind of weakness that makes you pause before stepping off a curb or reaching into a cabinet. Severe deficiency can affect the muscles closest to the center of your body, the very muscles you need for walking, balance, stairs, and standing up. The third sign is deep bone pain or body aches. This is one of the more classic adult signs when deficiency becomes serious enough to contribute to osteomalacia, which is softening of the bones. People may feel aching in the back, pelvis, ribs, hips, or legs. It can be mistaken for arthritis, old injuries, or just getting older. The fourth sign is struggling with stairs or getting up from a chair. This matters because independence is built on small movements: getting out of bed, getting off the toilet, carrying groceries, climbing the front steps. When those movements get harder, your world can shrink quietly before anyone else notices. The fifth sign is feeling less steady or having more falls. Vitamin D deficiency is not the only cause of falls, and exercise has strong evidence for reducing fall risk. But low vitamin D can contribute to weaker muscles and poorer function, which can make balance feel less reliable. A fall at 65 or 75 is not just a bruise. It can mean a fracture, a hospital stay, fear of walking, and less time doing the things that make life feel like yours. The sixth sign is the one linked to cancer, but it needs to be said carefully. This is not a symptom you feel. It is a low vitamin D blood level, measured by the serum 25-hydroxyvitamin D test. Observational research has linked low vitamin D status with a higher risk of some cancers, especially colorectal cancer. That does not prove vitamin D deficiency causes cancer, and supplement trials have not clearly shown that vitamin D prevents overall cancer in healthy adults. Still, a low level is useful information because it tells you something important about your nutritional and metabolic status. The seventh sign is low mood or feeling mentally duller than usual. Lower vitamin D levels have been observed in older adults with depression, and some research suggests supplementation may help depressive symptoms in some older adults. But vitamin D is not a standalone depression treatment. If your mood is changed, especially if it is new or worsening, it is worth discussing with a clinician. The eighth sign is frequent infections, especially respiratory infections. Vitamin D helps regulate immune function, and research suggests supplementation may modestly reduce acute respiratory infections in some settings. It is not a magic shield. But if you keep catching one thing after another, and you also have fatigue, weakness, or low sun exposure, it is another clue. The ninth sign is hair loss, or slow wound healing. Low vitamin D has been associated with certain hair loss disorders, especially alopecia areata and possibly female pattern hair loss. Slow wound healing is also biologically plausible because vitamin D affects immune signaling and skin repair. But it is not as classic as bone pain and muscle weakness. Think of these as possible clues, not proof. The pivot is simple. You do not have to panic, and you do not have to start swallowing giant doses, just in case. You start by finding out where you stand. Ask your clinician for a serum 25-hydroxyvitamin D test. Under 12 nanograms per milliliter is considered deficiency. From 12 to under 20 is generally inadequate. At 20 or above is generally adequate for most people. Over 50 may be too high and can be linked to adverse effects, so more is not always better. Then build the foundation at home, beginning with food. Food alone may not fully correct severe deficiency because natural vitamin D foods are limited. But food is still the best place to start because it brings vitamin D together with protein, calcium, healthy fats, and other nutrients your bones and muscles need. The strongest food first move is fatty fish. Aim for 2 servings of fatty fish per week. Salmon is one of the richest natural food sources of vitamin D, and it also gives you protein for maintaining muscle. Trout is another good choice. Sardines are especially useful because if you eat the soft bones, you get vitamin D plus calcium. The mineral vitamin D helps you absorb. If you eat dairy, use fortified milk as a steady baseline food. 1 cup a day can contribute useful vitamin D, and because it is fortified, the amount is more predictable than most natural foods. Fortified yogurt can help too, but check the label because not all yogurts have added vitamin D. If you avoid dairy, fortified plant milks can be a smart option. Choose unsweetened when you can, and shake the carton well because the added nutrients can settle. A simple D-friendly breakfast might be fortified milk with fortified cereal and eggs, or fortified Greek yogurt with a small serving of fortified cereal, or a smoothie made with fortified milk or fortified soy milk. Egg yolks provide a small natural amount of vitamin D, but they are not enough by themselves to correct deficiency. UV-exposed mushrooms can provide vitamin D too, but the amount varies, so treat them as a helpful supporting food. Do not forget calcium. Vitamin D helps you absorb calcium, but if calcium intake is poor, your bone plan is incomplete. Good food choices include plain yogurt, kefir, milk, calcium-set tofu, sardines with bones, canned salmon with bones, kale, and bok choy. For older adults with weakness, protein also matters. Salmon, Greek yogurt, eggs, cottage cheese, tofu, and beans can all help give muscles the raw materials they need. Magnesium also plays a role in vitamin D metabolism. Get it first from foods like pumpkin seeds, almonds, black beans, and spinach. If you struggle to get enough magnesium from food, there is a supplement option in the link in the description below that can support the food-first approach. It is not a replacement for testing, meals, or medical guidance. Cod liver oil deserves a caution. It is very rich in vitamin D, but it can also be high in vitamin A, which can be harmful in excess, especially if you are already taking supplements. Treat it more like a supplement than a normal food, and do not stack multiple high-dose products without supervision. A few habits matter too. If you are able, take a 10 to 20-minute walk outdoors most days, but do not intentionally overdo sun exposure just to raise vitamin D, because skin cancer risk is real. Add leg strength habits like walking, sit-to-stand practice, and light strength work. If you take vitamin D foods or a supplement, take them with a meal that contains some fat, because vitamin D is fat-soluble. Also review medications with your clinician or pharmacist. Orlistat, steroids, and thiazide diuretics can be relevant to vitamin D or calcium balance. And if your test confirms deficiency, your clinician may recommend vitamin D3. Adults 51 to 70 generally need 600 IU per day, and adults 71 and older generally need 800 IU per day. But confirmed deficiency is different and may require a short-term treatment plan. The goal is not to chase a trendy number. The goal is to protect your legs, your bones, your steadiness, your energy, and your time with the people you love. This week, do 3 things. Ask for the 25-hydroxyvitamin D test if you have these symptoms or risk factors. Add 2 servings of fatty fish or dependable fortified foods to your week, and practice standing up from a chair slowly and safely a few times each day. Aging brings changes, but weakness, deep aches, and constant exhaustion are not things you have to ignore. Your body may be asking for something basic. Listen early, test wisely, and build your strength back, one meal and one step at a time.